Do you have a chronic headache that's been bothering you for a while and you still can't figure out why? Every time you tell yourself it's probably just exhaustion, lack of sleep, or work stress. But the real question is this headache just a fatigue, or it could be something neurological, like migraine? That's exactly what we are going to find out in this video. Hello and welcome. I'm Dr. Muhammad, and in this video we will talk about the difference between regular headache and migraine. We will learn what causes migraine, how it develops, and what are its warning signs. Stay with me till the end, especially if you suffer from chronic headache, because today we will cover very important tips that can help you to reduce pain and headache frequency. Don't forget to subscribe to the channel so you won't miss the upcoming videos. Migraine is not just an ordinary headache, it's a complex neurological condition. It happens due to disruption in how the nerves communicate with blood vessels inside the brain, and that trigger pain center, resulting in strong pulsating pain, usually in one side of the head, often accompanied by unpleasant symptoms. We will talk about it shortly. Migraine does not appear suddenly from a single cause. It develops as a result of multiple factors interacting together, including genetic, neurological, and even environmental factors. Number 1, genetic factor. Studies show that about 80% of people with migraine have a first-degree relative who also suffer from it. That's why genetics is considered one of the most significant risk factors. And having a family history of migraine greatly increases your chance of developing it. Number 2, the neurological factor. In migraine, there are chemical changes occur inside your brain. One of the main ones is drop in the serotonin level, the neurotransmitter responsible for carrying nerve signals and regulating pain. When serotonin levels drop, brain becomes more sensitive to pain. Number 3, the environmental factor. Many environmental triggers can trigger an attack in people who are predisposed. These triggers include psychological stress and emotional tension. Mental stress, anxiety, or fatigue can easily act as a spark that sets off a migraine episode. Sleep disturbance, lack of sleep, or change in your normal sleep routine, such as staying up too late, can provoke the migraine. Certain foods and drinks. Some items are well-known triggers, especially in sensitive people, like chocolate, aged cheese, processed meats like hot dog or salami, or even pickled foods. Hormonal changes, especially in women. Fluctuations in hormonal levels before or during menstruation are one of the most common causes of migraine attacks in women. Lastly, environmental triggers, like bright lights, strong smells, or loud noise. All of these can trigger migraine attacks. Migraine does not have a single clear cause. It's a condition that happens because of the combination of all these factors working together. So to diagnose it properly, doctors need to understand the full pattern of the patient's life, family history, diet, sleep habits, and psychological stress. Now that we understand the causes and the triggers, let's move on to the most important part of this video: how migraine actually starts and what symptoms a person might feel. Migraine usually progresses through 4 stages. The first stage is prodrome, or the warning stage. This starts 1 or 2 days before headache and may include mood swings or irritability, unusual fatigue or drowsiness, craving for certain foods, neck stiffness, and frequent urination. The second is aura stage. This begins about an hour before the headache and may appear as flashing or zigzag lights in your vision, blurry or partial loss of vision, tingling or numbness on one side of your body, difficulty in speaking or concentrating. The third stage is headache stage. This is the worst phase. The pain is throbbing or pulsating, usually on one side of the head. It can last from few hours up to 3 days. It's often accompanied by nausea or vomiting, extreme sensitivity to light, sound, or even smell, difficulty focusing or speaking, tiredness and exhaustion. The last stage is post-prodrome or recovery phase. After the pain subsides, the patient may still feel dizzy, weak, moody, or have trouble sleeping. This stage can last for a day or two before returning back to normal. Many people confuse migraine with a regular headache, thinking that any pain in the head is migraine, or that migraine is simply a stronger headache. Actually, there are clear differences between regular headache and migraine. A regular headache feels like dull pressure or tightness over the whole head. A migraine, on the other hand, is much stronger, pulsating, and usually affect only one side. A regular headache typically gets better with rest or simple painkillers, while a migraine does not go away that easily and tends to return in recurring attacks. A regular headache does not come with additional symptoms, while migraine often brings nausea, vomiting, and sensitivity to light and sound. So not every headache is a migraine, but at the same time, no headaches that keep coming back should be ignored. Migraine have special pattern, stronger symptoms, and require special management and follow-up to reduce attacks and regain control. If you suffer from migraine, here's what you can do during the episode to reduce the pain. Number 1. The moment you feel warning signs, move away from bright light and loud noise. Find a quiet, dark place to rest. Number 2. Take your medications within the first hour of the headache. Number 3. Stay hydrated. Drink enough water, since hydration can make the pain worse. Number 4. Apply a cold or warm compress on your forehead or back of your head. This often helps reduce the intensity of the pain. The best treatment for migraine is preventing it from happening, because once an attack starts, managing it becomes much harder than avoiding it. So in this part of the video, let's go through the most effective evidence-based lifestyle steps that can actually reduce the frequency of migraine attacks and the severity of the pain. The first step is maintaining regular sufficient sleep. Studies show that irregular sleep or frequent changes in the sleep pattern can trigger migraine. So try to sleep and wake up at the same time every day, and avoid staying up late. Number 2. Eat regularly. Don't skip meals. Research shows that skipping meals or going long periods without food increases the risk of migraine attack. So make sure you have 3 balanced meals a day. Number 3. Stay hydrated. Dehydration affects blood vessels and brain activity, making migraine more likely. So make sure to drink water regularly throughout the day, especially if you exercise or spend time in hot weather. Number 4. Exercise and walk. Studies recommend regular moderate activity, such as walking. It helps reduce the frequency of attacks, improve mood, and regulate your circulation. Number 5. Identify and avoid your personal triggers. Each person's triggers are different. Bright light, certain food, or stress. Pay attention to what you were doing or eating before each attack and avoid it next time. Number 6, and lastly, manage stress and emotional pressure. Stress and chronic tension are common migraine triggers. So try to relax and avoid being in tension through breathing exercise, meditation, or simply taking breaks during your day, because your mental state directly affects your headache. And that brings us to the end of our video. I hope you found it helpful and informative. Tell me in the comments below, do you suffer from migraine and what usually triggers it? Don't forget to subscribe to the channel so you don't miss the upcoming videos. Stay healthy until I see you in the next video.